Hi, I'm Dr. Ryan Westbrook, and I want to talk to you today about something that might surprise you. After decades of practicing medicine and watching my patients navigate healthcare in their later years, I've come to realize that some of the medical checkups most people think they need after 60 can actually do more harm than good. Yeah, I said it, and I'm going to explain exactly why. Now, before anyone gets upset with me, let me be clear. I'm not saying don't see your doctor. What I'm saying is that we need to be smarter about which tests we get, when we get them, and most importantly, what we actually do with the results. Because here's the truth that nobody wants to talk about. Over-screening in older adults has become a massive problem in modern medicine. The statistics are staggering. Studies show that up to 30% of healthcare spending in the United States goes toward unnecessary tests and treatments. For seniors, that number gets even higher. And the worst part? Many of these tests don't extend our lives. They don't make us healthier. What they do is create anxiety, lead to unnecessary procedures, and sometimes cause real physical harm. I've seen this happen countless times. A patient comes in, we run a test that wasn't really needed, we find something that looks abnormal, and suddenly we're on a treadmill of follow-up appointments, biopsies, and interventions that the patient never actually needed. It's a problem we call overdiagnosis, and it's particularly common in people over 60. So today, I want to share with you the 5 medical checkups that I would personally never get after 60. And more importantly, I want to explain the science behind why. Let's start with the first one. Number 1 is the PSA test for prostate cancer screening in men over 70, or even over 60 in many cases. Now, I know this one's going to be controversial because we've been taught for so long that regular PSA testing saves lives. But here's what the actual evidence shows us. The PSA test measures prostate-specific antigen, a protein made by the prostate gland. The problem is that an elevated PSA doesn't necessarily mean you have cancer. It can mean you have an enlarged prostate, you have an infection, or you just naturally have higher levels. And here's the really important part. Most men over 70 who have prostate cancer will never know they have it, and it will never cause them any problems. They'll die with prostate cancer, not from it. Multiple large studies, including the prostate, lung, colorectal, and ovarian cancer screening trial, showed that PSA screening doesn't significantly reduce death rates in men over 70. What it does do is detect cancers that would never have caused harm, leading to biopsies, and then treatments like surgery or radiation that come with real side effects. We're talking about erectile dysfunction, urinary incontinence, and bowel problems that can seriously impact quality of life. The American Cancer Society now recommends against routine PSA screening for men over 75, and even for men between 50 and 70, they say it should only be done after a discussion about risks and benefits. If you're over 70 and you don't have a family history of aggressive prostate cancer, I would seriously reconsider getting this test. Your quality of life is worth more than finding a cancer that probably won't hurt you. Number 2 is routine colonoscopy screening after age 85. Now, I'm not saying never get a colonoscopy. Colorectal cancer screening is important. But the question is, when does it stop being beneficial and start being harmful? Here's what we know. The benefits of colonoscopy decrease significantly with age. If you've been regularly screened throughout your 50 seconds, 60 seconds, and 70 seconds with normal results, your risk of developing colorectal cancer in your 80 seconds is extremely low. And here's what most people don't realize. Even if we find cancer in someone who's 85 or 90, treating it often causes more problems than it solves. Colonoscopies themselves carry risks, especially in older adults. There's the risk of perforation, bleeding, and complications from anesthesia. For someone in their late 80 seconds, potentially frail with other health conditions, these risks outweigh the benefits. Studies consistently show that the oldest adults don't live longer or healthier lives because they got a colonoscopy at 85. Plus, if you're already 85 and you haven't developed colorectal cancer despite decades of living, the likelihood that a cancer is going to suddenly appear and threaten your life in the next 5 years is genuinely low. I'd rather see an 85-year-old spending their time with family and enjoying their life than recovering from a colonoscopy and its complications. After 85, unless you have specific symptoms, I would skip this one. Number 3 is routine screening mammography after age 74, And I say this as someone who absolutely supports breast cancer awareness and screening in appropriate age groups. The facts are these. Mammography screening has real benefits for women in their 40 seconds through 60 seconds. But as we get older, the benefits decrease and the harms increase. For women over 74 with no history of breast cancer, routine screening doesn't significantly extend life. What it does do is find cancers that would never have caused a problem. This is the overdiagnosis issue again. We detect breast cancers in older women that are growing so slowly that the woman will die of something else long before the cancer ever threatens her. But because we found it, she now has to make a decision about treatment. Do you do surgery? Do you do radiation? Those treatments come with real side effects in older bodies. Mammograms also have a false positive rate, and as you get older, your breast tissue changes, making it harder to interpret mammograms accurately. This leads to more biopsies, more anxiety, more procedures. And here's the thing. The American Cancer Society recommends that women over 74 should only continue screening if they have a life expectancy of at least 10 more years and have previously had normal screening results. Think about that. If you're a woman over 74, you should only be screened if you're likely to live past 84. That's the actual evidence. So if you're 75, you're healthy, you've had normal mammograms your whole life, I would seriously consider stopping routine screening. Have a conversation with your doctor about what actually makes sense for you. Number 4 is the carotid artery ultrasound screening if you have no symptoms. This is a test that's become increasingly popular, especially marketed to older adults as a way to prevent stroke. And it's one of the most unnecessary tests I see ordered regularly. Here's why. The carotid arteries in your neck carry blood to your brain. Plaque can build up there, and sometimes a narrowed carotid artery can cause a stroke. So the thinking is, let's screen for this in older adults and catch it before a stroke happens. Sounds logical, right? The problem is, the evidence doesn't support it. Studies show that screening for carotid artery disease in people without symptoms doesn't prevent strokes. It just doesn't. What it does do is find abnormalities that then lead to further testing, sometimes ultrasounds, sometimes imaging, and sometimes interventions that aren't necessary. Worse, the test itself isn't even that accurate. You can have significant plaque in your carotid artery and never have a stroke. You can have no detectable plaque and have a stroke anyway. The presence of plaque doesn't reliably predict who's going to have a stroke. So what are we actually achieving by screening for it? If you have symptoms like a past history of stroke or TIA, transient ischemic attack, or you have severe carotid disease that's been found because of symptoms, that's different. But if you're 70 years old, you feel fine, you have normal blood pressure, you don't have a history of stroke, I would skip the carotid ultrasound. You don't need to know about every little abnormality in your blood vessels. That knowledge just creates unnecessary anxiety and often leads to unnecessary treatment. Number 5 is screening for lung cancer with CT scans, if you've been a former smoker but have no current symptoms or risk factors. Now, before anyone thinks I'm against detecting lung cancer, I'm not. Lung cancer is serious, and for current smokers, especially heavy smokers, screening can make sense. But here's what I'm talking about. The person who quit smoking 20 years ago feels fine, has normal lung function, and is being offered a screening CT scan. CT scans expose you to radiation. For someone over 60, especially if you have other health conditions, that radiation exposure carries a real risk. You're increasing your risk of developing cancer, ironically, from the screening itself. We're talking about 100 to 200 people needing to be screened with CT scans to potentially prevent one death from lung cancer. Additionally, CT scans find abnormalities. A lot of them. Some of those abnormalities are harmless nodules that will never bother you. But they require follow-up imaging, more radiation, biopsies, and anxiety. I've seen this happen so many times. A former smoker gets a screening CT, a small nodule is found, and suddenly they're in a spiral of worry and follow-up tests, sometimes for years, only to discover years later that nodule never did anything. If you quit smoking and it's been years, your risk of developing lung cancer drops significantly over time. After 20 years, your risk is approaching that of a never smoker. So unless you're still smoking, I wouldn't get routine lung cancer screening scans just because you used to smoke. Okay, so I've told you what not to get. Now let me tell you what actually matters as you get older. First, regular primary care that focuses on what's called functional fitness. Can you walk? Can you maintain your independence? How's your balance? Can you climb stairs? These things matter infinitely more than finding an incidental abnormality on a test you didn't need. Second, addressing the major risk factors that actually prevent disease and extend life. We're talking about blood pressure control, regular physical activity, good nutrition, maintaining social connections, getting quality sleep, and managing stress. These aren't sexy. Nobody makes money off them the way they do from ordering tests, but they work. Third, getting appropriate age-related preventive care. Women over 50 should continue blood pressure screening. Men over 40 and women over 50 should have their cholesterol checked. Everyone should continue getting colorectal cancer screening up until about 75 if they've had normal results. Everyone should continue managing chronic diseases like diabetes. These things have proven benefits. Fourth, any screening that's based on symptoms that you actually have. If you're short of breath, get your lungs checked. If you've had chest pain, get a heart evaluation. If you're having digestive problems, maybe endoscopy makes sense. Symptoms are actually informative. Tests ordered randomly without symptoms are often just noise. Finally, be an active participant in your own care. Ask your doctor why he or she is ordering a test. What will you do with the results? If the answer is, well, we'll probably just monitor it, ask yourself if you really need to know about it. Having knowledge that you can't act on and that doesn't change your treatment is often not a gift. It's a burden. I want to be absolutely clear about something. I'm not anti-screening. I'm not anti-test. What I am against is mindless screening, unnecessary tests, and the over-medicalizing of normal aging. Your job as you get older isn't to try to detect every possible abnormality. Your job is to maintain quality of life, independence, and health. Those are different things. Talk to your doctor about your risk factors, your health history, your life expectancy. Don't just follow a standard protocol that applies to everyone, because you're not everyone. You're a unique person with your own health story, and you deserve personalized medicine, not one-size-fits-all screening. The ultimate irony in modern medicine is that we often screen for diseases we wouldn't treat anyway, find abnormalities we can't meaningfully do anything about, and create anxiety and harm in the process. I want better for my patients, and I want better for you. So as you navigate your healthcare in your 60 seconds, 70 seconds, and beyond, I want you to remember this. More tests isn't always better. Knowing about every possible abnormality isn't always helpful. And sometimes, the bravest thing you can do is say no to a test that doesn't make sense for you.